So the final part of this section is about pregnancy aversions and cravings. So you probably hear of pregnant women wanting to eat pickles or um, polishing off three grapefruits in one sitting and wishing they had more, or avoiding steak or chicken, or craving foods they never thought they'd like, or horrified by their former favorite foods. So this is the wide world of pregnancy cravings and aversions, where um, taste buds are changed and culinary common sense goes out the kitchen window. And more than 75% of all expectant moms experience food cravings, and most moms to be experience at least one aversion. So, common cravings are things like ice cream, sweets, candy, fruit, even fish. Um, so, pica, those are things, cravings for ingestion, craving for ingestion of non-food substances, things like clay or laundry starch or ashes, things with no nutritional value. But most women experience some food craving and aversions during their pregnancy. Um, Common aversions include things like coffee, highly seasoned foods, and fried foods, and maybe due to the heartburn. But it's not know why. We really don't know why women have these cravings and aversions. There has been some suggestion that hormonal or physiological changes during pregnancy, in particular changes in taste and smell, may be the cause, but psychological and behavioral factors are also involved. Usually, the foods that pregnant women crave are not harmful and can be safely included in the diet to meet not only nutritional needs but emotional needs and individual preferences. But pica during pregnancy can have some serious health consequences. Women with pica commonly consume non-food substances such as clay, laundry starch, or ashes, and consuming large amounts of these substances can reduce intake of foods we should eat. So the nutrient-dense foods inhibit some nutrient absorption and increase the risk of consuming toxins, and can even cause intestinal obstructions. Some complications of pica include iron deficiency anemia, lead poisoning, and parasitic infestations. And we know that anemia and high blood pressure are more common in those with pica than among other pregnant women, but it's not clear whether pica is a result of these conditions or a cause. In newborns, anemia and low birth weight are often related to pica in the mother. Excuse me. So here's a picture. This is in your book, and this is an African American woman in Georgia who is eating a white clay called kaolin, which some women crave during pregnancy. And eating kaolin is also a traditional remedy for morning sickness. This particular example of pica may be related more to cultural beliefs and traditions, but pica is also believed to be triggered by nutrient deficiencies, stress, and anxiety. It is most common in African American women, women who live in rural areas, and in those with a childhood or family history of pica. So let's move to the next section, 9.3, factors that increase the risks associated with pregnancy. So we're going to talk about critical periods of prenatal development and how nutritional status can influence the outcome of pregnancy, and how a pregnant woman's age and health status also affect the risks associated with pregnancy. And then we're going to talk about alcohol, mercury, cocaine, and a few other things on the outcome of pregnancy. Okay, so increased risk during pregnancy. So we know that anything that interferes with embryonic or fetal development can cause a baby to be born too soon, too small, or result in a birth defect. The embryo and the fetus are particularly vulnerable to damage because their cells are dividing rapidly, differentiating, and moving to form organs and other structures. So developmental errors can be caused by deficiencies or excesses in the maternal diet and by harmful substances that are present in the environment, consumed in the diet, or by taking medications or recreational drugs. And any chemical, biological, or physical agent that causes a birth defect is called teratogen, and it's an agent that causes a birth defect during this critical period of development. And because each organ system develops at a different time and rate, each has a critical period during which exposure to a teratogen is more likely to disrupt development and cause irreversible damage. So severe damage can result in a miscarriage, but some women are at increased risk for complications during pregnancy because of their nutritional status, their age, or pre-existing health problems, and others can be at risk due to exposure to harmful substances. So, excesses of deficiencies or weight or nutrients can affect hormone levels and fertility, and we know that during pregnancy, malnutrition of the mother can cause fetal problems, growth retardation, low birth rate, birth defects, premature birth, spontaneous abortion, and stillbirth. And it can also affect the child's risk of developing chronic diseases such as heart disease, high blood pressure, stroke, high blood cholesterol, diabetes, obesity, and osteoporosis. So here is a diagram of the critical periods of development, and they're different for different body systems. And because the majority of cell differentiation occurs during the embryonic period, this is the time when exposure to teratogens can do the most damage, but vital body organs can still be affected during the fetal period. And we know that 1 in every 33 babies born in the United States has a birth defect. Okay, so what was the Dutch famine? That was a very interesting time during World War II. There was an embargo on food transport to the Netherlands between the winter of 1944 and 1945, and it caused the average intake per person per day to drop below 1,000 calories. So what happened was pregnant women gave birth to smaller babies, and in adulthood, the affected babies were more likely than others to have diabetes, heart disease, obesity, and other chronic diseases. The WIC program, probably one of the best programs out there, and one I'm very passionate about. So we know that one of the greatest risk factors for poor pregnancy outcomes is poverty, or limited access to food, education, and health care. And low-income women are unlikely to receive medical care until late in pregnancy, and consequently have a high incidence of low birth weight and preterm infants. So a federally funded program that addresses the nutritional needs of pregnant women is the Special Supplemental Nutrition Program for Women, Infants, and Children, so WIC. And this program provides vouchers for the purchase of nutritious foods and referrals to health and other services for low-income women who are pregnant, postpartum, or breastfeeding, and for infants and children up to age 5 who are at risk for malnutrition. Teenage pregnancy, so we know that pregnancy places all these stressors on the body at any age, but these stresses have the greatest impact on women in their teens or those over age 35. rather than women between those ages. So pregnant teens are still growing, so their nutrient intake must meet the needs for their growth as well as for the pregnancy. And pregnant teenagers are at increased risk of hypertensive disorders and more likely than pregnant adults to deliver preterm and low birth weight babies. And we even know that teenagers who deliver normal birth weight infants may stop growing themselves during this time. So, to produce a healthy baby, a pregnant teen needs early medical intervention and nutrition counseling. And we know that the rates of teenage pregnancy have decreased over the past few decades. It's still a major public health problem. So here's a graph that shows the nutrient needs of pregnant teens and how they're different from those of pregnant adults. And the DRIs include a special set of nutrient recommendations for this group. And here we can see the recommended daily micronutrient intake for 14 to 18-year-old girls during the second and third trimesters of pregnancy compared to the recommendations for 14 to 18 non-pregnant girls. And you can see where the needs are above the non-pregnant recommendations. What about pregnancy over the age of 35? So for those nutritional recommendations for older women during pregnancy, and sometimes they call it advanced maternal age, but really now more and more women are in this age group. So there are additional risks. These women over the age of 35 are more likely to already have one or more medical conditions, possibly cardiovascular disease, kidney disorders, obesity, or diabetes. And these conditions could increase the risks associated with pregnancy. There are also women over the age of 35 are more likely to develop gestational diabetes, hypertensive disorders of pregnancies, and other complications. These women over 35 also have a higher incidence of low birth weight babies, preterm birth, stillbirth, and perinatal death, though it's still very low for the actual rate of stillbirth or neonatal death. And this over 35 group also have increased risk of having a baby with Down syndrome, and as well the frequency of twins and triplets is higher in these women over 35 because of their greater use of fertility treatments. And multiple pregnancies increase nutrient needs and the risk of preterm delivery. So here we can see, as with age, the increased risk of Down syndrome increases significantly. We also know other increased risk during pregnancy is any woman who's had multiple miscarriages is more likely to have another. One child with birth defects has an increase for defects in subsequent pregnancies. Less than 18 months between pregnancies has increased. These women have an increased risk of delivering smaller babies because their bodies haven't recovered from the first pregnancy. And those with only 3 months between pregnancies has an increased risk of preterm infant and neonatal death. We know when we talk about toxic substances or exposure to toxic substances during pregnancy, caffeine is associated with an increased risk of miscarriage and low birth weight. So recommendations are to limit caffeine to 1 to 2 cups. That's 8-ounce cups of coffee a day, or 2 to 3 20-ounce soft drinks. Mercury in fish can cause developmental delays and brain injury. So consuming 8 to 12 ounces of seafood a week from a variety of seafood sources, avoiding fish high in mercury, and limit fish with lower amounts of mercury. So sources of lean protein and omega-3 fatty acids and iodine, so it's important. Lots of food safety recommendations during pregnancy. Cautious with fish, high mercury fish avoid. Don't drink raw or unpasteurized milk. Don't eat smoked fish, deli salads, Don't eat hot dogs or lunch meat, undercooked meat, or unwashed fruit, vegetables, sprouts, or unpasteurized juice, because all of these increase your risk of foodborne illness during pregnancy. I'll stop here till the next section.